And welcome to another Mark Bishop show. Well, every year, Medicare beneficiaries have the opportunity to make changes to their health benefits during Medicare's annual election period, the AEP. This year, as we continue to fight a global pandemic, it is more important than ever to have comprehensive health coverage. As people 65 and older shop online for the holidays, you can also shop for their health plan, your health plan. That's good news, especially for those concerned about leaving their homes and being exposed to COVID-19. Well, my guest, Gary Culp, is Medicare Advantage Expert. He's a Chief Growth Officer at Cigna. Welcome, Gary.
Thank you, Mark. I hope you're having a great day today.
Well, mate, this time of year. It gets busy. We try to tell as many people as we can. We know that the Medicare annual election period is the time for reassessing our Medicare plans, right? I mean, when does it end?
Well, the annual election period actually started on October 15th, and it runs all the way through December 7th. And you're absolutely right. This is the perfect time for Medicare beneficiaries to consider what's important to them for their healthcare decisions for this upcoming year.
Well, you're the man. How about you discuss some tips for us, Gary? Would you be kind enough to do that?
Absolutely. So the way that I look at it is the goal should be to find the health plan that maximizes the well-being of each individual. It actually gives them a peace of mind and then helps them in terms of making healthcare simple, affordable, and predictable, which is, in this, kind of considering what healthcare delivers is really important. And there's a couple of things I would say. One is that people really should take a look at what health changes they're looking for in the upcoming year to really balance what they need in terms of their healthcare. Things that they should look at are things like their networks. So what doctors are in their network, what facilities are in their network.
Mm-hmm.
They should also look at what the financial commitments are. So what are the copays, deductibles? Is there any premium? For example, Cigna has Medicare Advantage plans that don't have a premium. So all these are the considerations that I would say people should be looking at. Right.
Well, that's good to hear. Cigna, no premiums, eh? Now, go online. That is a thing we try to get across, to visit Medicare's Plan Finder, Medicare.gov, or if, it's possible, to attend a virtual educational session. There's the good old Odie Cologne, the telephone. Just pick it up, correct? Call individual plans or independent brokers. Ask questions to clearly understand all the options that are out there. What about seniors? Gary, let's zero in on them. What tips would you give to seniors as they shop for their 2022 health benefits?
Mark, you called out a lot of the great ways to figure out what are the ways to look at different plans and what are the right options. So you're right, you can go online to cms.gov for the Medicare Plan Finder. You can also go to cignamedicare.com as well as call us. So those are all examples of ways that you can connect to find out more information. The things that I would focus on as a senior looking at healthcare is really what are the things that are important to me. This is a very personal decision. So it may even be different within a household, where a husband or wife may look at things differently in terms of what their needs are.
Mm-hmm.
And really it's kind of back to those things of who are the doctors I want to see, and are they in the network? What are some of the costs and benefits? So for example, Cigna offers many additional benefits in our plans, for example, vision, hearing, dental, even telemedicine. So you've referenced some of the changes around healthcare related to the COVID pandemic, and having telemedicine is a really critical element to consider, knowing that it gives people the option of actually visiting with their provider, via phone or iPad or other ways to really connect on the health level with their provider, in addition to still being able to go into their offices if that's what they prefer.
Well, in what ways is Medicare Advantage different from original Medicare?
Well, original Medicare, is really, it covers, extensive amounts of health care for beneficiaries. But what Medicare Advantage does is it takes it one step further. And so I referenced the things like, hearing and vision and dental care and benefits that traditional Medicare does not offer. So what Medicare Advantage does is it takes the coverage that Medicare traditionally offers and adds actually more to it. So if I were a senior looking at healthcare, I'd be considering, what are some of the gaps that I currently have with my original Medicare, and looking at Medicare Advantage is possibly a way to fill those gaps because it adds additional coverage. The other thing that's nice is that most of the Medicare Advantage plans, and particularly those that Cigna offers, have integrated pharmacy drug benefits. So it's a nice way to have the holistic health in terms of having both the health and wellness benefits of the plan, but also the prescription drugs that are important.
Folks, remember, as Gary mentioned before, www.cigna, that's cigna.com/Medicare. A great site, a lot of info on it. You've got to consider costs these days. You've got to know the plan's premium or monthly cost. You've got to check out for out-of-pocket costs, including copays and deductibles, on doctor and hospital visits and prescription drugs. And Gary mentioned before, you could end up with no copay. So that's darn good with Cigna. Know your network too, right, Gary? Check to see if your favorite facilities and doctors are in the network. Often that is forgotten, and it's a disappointment to some people, isn't it?
Yeah, Mark, it's a great point. And, our relationship with our providers, and specifically our primary care doctor or the physicians that are actually helping us and guiding us through our healthcare, are really important. So that is a key to look at the network and see who's in the network and aligned with the plan. And with thousands of doctors that are part of Cigna's plan, I encourage people to take a look at what options we offer, because it, likely is going to have a plan that has your doctor in it as well.
Yeah, and one of the other big points, of course, is prevention. In this day and age, you can't forget about prevention, folks. You've got to talk to your doctor about necessary screenings and vaccinations, including the flu shot. With what's going on at the moment, yes or no, and anti, it's all very well, but the flu shot, we take that every year automatically. So these are especially important at this time of the year. Is there anything specific, COVID-19, let's touch on that, Gary. Do you think it's changed the priorities of what to look for in a health plan?
I think it has, in the sense that we talked a little bit about how to find information. For example, you'd referenced our website and the ability to actually phone in. There's an example where you can virtually connect with people to find information, which during the pandemic meant that we could actually help people, guide them through healthcare decisions. In terms of delivery of healthcare, that's also important. So, many of our plans offer telemedicine options, which actually provide that ability to continue to stay healthy and stay connected with your provider in a virtual setting. So there's several things that I would say have actually evolved as a result of, the pandemic, and they're actually benefits in terms of the way that our, customers actually look at our plans and can navigate them in terms of their decision process as well as accessing care.
Yes, Gary, you're right. You've got to look up and weigh extras because it doesn't take that long. Put a little bit of time and effort into it. Extra benefits that are not available in original Medicare, they can be built into an MA plan, such as dental. You mentioned that. Vision, transportation too, and the telehealth visits. That's becoming, even more prominent now, isn't it?
It absolutely is. And all those extra benefits are important. You referenced actually transportation. That one I'll call out in just a moment, because when I think about some of the things that may be barriers to people getting to their doctor for their wellness visits that we talked about, for a plan like some of the plans that Cigna offers that include the transportation, we're removing that, barriers so that we can help people actually get to their providers for the visits that they'll, need to do with their providers, whether it be preventative with the wellness, with some of the screenings or inoculations that you referenced, or regular visits that they may have scheduled as well.
That's great stuff. Well, you've been around a long time, Cigna, my friend. Household name, do a great job. Now, the site itself, it's got everything on it. It's easy to navigate, right, for information.
It absolutely is. It has tools and resources to be able to help people navigate, but I also want to just stress that we're here to help. So whatever the best way is for people to, whether they want to call in, talk to us over the phone, we have agents that are experts around Medicare and the options that are available. They can look up, providers within your local community, help you find your doctor, help you find your facility to confirm. They can also look up, medications that people are taking and confirm that they're, covered on the plan and what the copay would be for those medications. So, really the bottom line is that we're here to help. And in the way that you want, or your, listeners want to actually receive help. So we've got agents that are in the local community that can actually meet with them in their home or their office. We have group settings. I know some people like to go to the group settings because they get to hear questions that others may ask that they hadn't thought of.
Mm-hmm.
So there's several different ways that people can engage with us and we can help them.
All right. And in closing, Gary, speaking of the local that you just touched on, are those local numbers, regional numbers, city numbers, are they all on the website?
They are, but let me just call it out real quick. We have a toll-free number. It's 1-800-870-2169. It's open 8 to 8 local times. So it doesn't matter where someone's calling from. It's open from 8 to 8, and it's 7 days a week.
Thank you, Gary. Appreciate your time. You've got a lot of other interviews to do. Get the good word out for people. We appreciate it. Gary Culp, ladies and gentlemen, Medicare Advantage, and he is an expert. He's the Chief Growth Officer at Cigna. Thank you, Gary.
Thank you, Mark. Have a great day today.
You too. Bye.